A local organization and school are shining a light on the health disparities that exist in Idaho's Hispanic community.
During Wednesday's first ever Latino American Indian Health Conference, new data was released showing just that. Brenda joins now to tell us more about that report. Brenda.
Maggie, Justin, it's been over 10 years since a report like this one was made. This time around, the Idaho Hispanic Health Report shows two major points: obesity and the hardships of accessing health insurance. More than 239,000 Hispanics live in Idaho, making them the fastest growing and largest ethnic group in the Gem State. But within that group, there are still huge gaps when it comes to health.
Health and education continue to be the biggest issues when it comes to Idaho's Hispanic population.
Idaho Commission on Hispanic Affairs and Idaho State University work together to collect data. And one of their biggest findings for the Idaho Hispanic Health Report: obesity.
We're also seeing that we tend to be more overweight than our counterparts. That also leads to a lot of diabetes.
The report shows that 74.6% of Hispanic adults are overweight. That's compared to 67.5% of non-Hispanic adults. ICHA's community resource specialist, JJ Saldaña, says this stems further than just the foods they eat.
A lot of people here in Idaho in the Hispanic community, they have some really hardworking jobs, so they don't really, when they get off work, that's their downtime. That's time to relax. And we're not going out to the gym as much as our counterparts are either.
And when it comes to children, the report shows Hispanic high school students are less likely to join a sports team, limiting their access to staying active.
Cost is a big deal because, you have to pay for uniforms, you have to pay for your physicals, you have to pay for this. And then I also think it's a kind of an acceptance. I think a lot of students still don't feel like they would be accepted to trying out for certain sports. It could be very cliquey in some cases.
Accessing health care is also an issue in Idaho's Hispanic community. Saldaña says Hispanics are less likely to have health insurance because of cost and because some agricultural or hospitality jobs don't offer health insurance. The report shows 25.2% of Hispanic adults and 10.5% of children are uninsured.
I had conversations with families that told us, okay, so we dropped our insurance because we either had to pay the power bill this month or our insurance, and we couldn't just not pay the power bill, so we dropped our insurance. And so I think having more accessible insurance, I think, is going to play a crucial key.
Another disparity: the limited access to healthcare providers.
We do need to do a lot better. I think a lot of these smaller towns in Idaho, and it's not just the Hispanic communities, but we have to travel in order to get any kind of health care.
In 2020, Idaho saw 16,402 total deaths statewide. Of that number, 733 were Hispanic. The report shows 19.2% of those Hispanic deaths were caused by COVID-19, making it the leading cause of death for that community.
There was a lot of misinformation. We, as a state, did not do a good job getting the word out to our Hispanic population, specifically the monolingual population. I think by the time they were getting information, it was really late.
On Wednesday, ICHA hosted their first Hispanic/American Indian healthcare conference in Twin Falls to talk about these issues with health agencies.
They want to know how they can do a better job. They have said, help us, we want to do better. How can we do better outreach? And so I think that's a really, really great opportunity for us to have right now.
And another part of this report: many Hispanic and Latinos rely on relatives or just community members to help heal using a traditional system, also known as curanderismo, which is a holistic approach. We do cover this type of healing on our website at ktvb.com.
All right, Brenda, thank you.